Nosocomial infections, or hospital-acquired infections, HAIs, have become a pressing concern in healthcare settings across the globe. These infections can develop in patients during their stay in hospitals and are often associated with significant morbidity, prolonged hospital stays, and increased healthcare costs. Recent studies indicate that the global prevalence of nosocomial infections is approximately 14%, with an annual increase of 6%. This means that for every year, the rate of HAIs rises, reflecting a growing challenge for healthcare providers. Research has shown that certain regions experience higher rates of nosocomial infections. For instance, Central Africa has been identified as having the highest prevalence, estimated at 27%. This alarming statistic can be attributed to various factors, including limited access to healthcare resources, inadequate infection control practices, and socio-economic challenges. In contrast, the prevalence in some low-income countries is reported to be around 32%, highlighting the disparities in healthcare quality and access. The most common types of pathogens responsible for nosocomial infections include Escherichia coli, Staphylococcus aureus, and Pseudomonas aeruginosa. These organisms are often resistant to multiple antibiotics, complicating treatment options and leading to higher mortality rates. The mortality associated with HAIs can be significant. Studies suggest that up to 50% of patients with certain types of nosocomial infections may not survive. To combat this growing issue, healthcare systems are increasingly adopting modern prevention strategies. One effective approach is the implementation of stringent hand hygiene protocols. Research has shown that proper hand hygiene can reduce the transmission of pathogens by up to 40%. Additionally, the use of advanced disinfection technologies, such as ultraviolet, UV, light and electrostatic spraying systems, has proven effective in reducing infection rates in hospital environments. Another promising method involves the use of antimicrobial stewardship programs aimed at optimizing the use of antibiotics. These programs educate healthcare professionals about appropriate prescribing practices and monitor antibiotic usage within hospitals. Evidence suggests that implementing such programs can lead to a 30% reduction in antibiotic resistance rates among nosocomial pathogens. Furthermore, continuous education and training for healthcare workers play a crucial role in preventing nosocomial infections. Regular workshops and training sessions on infection control measures have been shown to improve compliance with hygiene practices among staff members. Studies indicate that facilities with robust training programs experience lower rates of HAIs compared to those without such initiatives. In conclusion, while nosocomial infections remain a significant challenge globally, recent advancements in prevention strategies offer hope for reducing their prevalence. By focusing on effective hand hygiene practices, implementing antimicrobial stewardship programs, and providing ongoing education for healthcare workers, it is possible to mitigate the impact of these infections on patient health and safety.